Why, thank you, Madam Speaker. To the bill.
To the bill.
As many of you know, I've been a nurse for over 20 years now. I spent my career not only at the bedside, but on the front lines, fighting to ensure that nurses have a voice, a union, and a say in the conditions that define their work and the care that they deliver. As this session began, Oregon entered into a historic healthcare strike. Thousands of nurses and frontline providers at Providence made the decision to strike, not because they wanted to, but because they had to. Some had been working under an expired contract for more than a year. And their why? They were striking for dignity, over upholding the safe staffing standard that this legislature passed, for the ability to do the jobs they trained their whole lives to do, and for the health insurance that would afford their families the same quality of care that they provide to others. As one nurse said, a lot of people think that if you work in healthcare, you're going to have great health insurance, but that's rarely been the case for me. But this wasn't just about health insurance. This was about the crisis unfolding inside of our hospitals. Physical abuse from patients, chronic understaffing, relentless burnout, and the heartbreaking reality that even our most dedicated nurses could not provide the quality care that patients deserve. And here's what cuts the deepest. These are the very same nurses we all once called heroes just a couple of years ago. Do we remember that? But when the headlines faded and the jobs got harder, they weren't treated like heroes by their employer. They were pushed to the edge. So they did the only thing they could do. They used the last bit of leverage that they had and made the decision that no healthcare provider wants to have to choose. They struck. They forced Providence to the table to make meaningful change for themselves and fundamentally their patients. And what they did mattered. We know that collective action doesn't just help workers, it saves lives. When nurses in New York went on strike over nurse-to-patient ratios, patient safety measurably improved. When the UAW struck in 2023, wages rose across an entire industry, even at non-union plants. And yet, while Providence nurses were striking to protect their patients, they were visiting food pantries and burning through their hard-earned savings just to survive. That's the cost of taking a stand in America today, and it's a high cost. But that cost shouldn't fall on the shoulders of those who are fighting to make the system better, Madam Speaker. Many of us in this chamber stood with those workers on the picket line. I've seen the photos, I know your hearts. But today, I'm asking you all to go further, to turn solidarity into policy, to pass a bill that would allow workers, just like those Providence nurses, to access temporary wage replacement during a strike. This legislation, it wouldn't provide for full wage replacement for many Oregonians on strike, with a max of just $836 a week after 2 weeks on strike. That would be just enough for many to keep the lights on, to buy groceries, to not have to choose between standing up and staying afloat, and enough to allow them to come home to their children and say, I can fight for a better tomorrow and still fight for you. As someone who has sat at the bargaining table more times than I can count, I'll tell you this. Senate Bill 916 won't encourage strikes, it will shorten them. I wouldn't be standing here today if I thought this bill would lead to a massive increase in strikes. It will bring employers to the table faster, prompting many of them to bargain in better faith. And most importantly, it sends a message to every nurse and healthcare worker who stayed past their shift, held a patient's hand through pain, and kept going when the system didn't. That when you fight for better, we fight for you. This is about more than process. It's about respect for the nurses and other healthcare workers who are our constituents and for the patients they care for every single day. Because when they rise, their patients rise, our communities rise, and we all rise. So let's rise with them. Let's pass Senate Bill 916 and show that in Oregon, we don't just honor the people who care for us, we stand with them when it counts and don't believe that hard-working workers should starve just because they took a stand. I've been a member of this body since 2022, and I believe that this is the biggest vote that I have ever taken. And I have no doubt that the eyes of our entire state are looking upon us today. With that, I encourage the members of this chamber to join me in voting aye. Thank you.